Hi, this is Dr. Baxter from the Alabama Tongue Tie Center. We're going to talk about tongue and lip ties for infants. So what is a tongue tie? A tongue tie is a too thick, tight, or short remnant of tissue from fetal development under the tongue that restricts normal tongue movement and causes a functional issue. The symptoms the child has are more important than the appearance. So a full assessment of related issues is the key to diagnosing a tongue tie. Having a patient stick the tongue out is the worst test to determine the presence of a tongue tie. Elevation, or having the patient open wide and lift the tongue to the palate, is the best quick test for older children, or lifting the tongue on a baby is the best test. Elevation or lifting the tongue is the critical movement for the key activities of nursing, swallowing, and speaking. A lip tie is a remnant of tissue that is abnormally tight or thick that causes difficulty lifting the lip as required for nursing, feeding, speech, or for cleaning the teeth. It also can cause a gap in the teeth, and if it's wider than 2 millimeters, it may need to be released and will not likely close on its own, especially if another functional issue is present. And always, if it ain't broke, don't fix it. So tongue and lip ties come in different appearances. So on the top, we have 3 different lip ties. On the bottom, we have 3 different tongue ties. Some are more obvious to the tip. Others are more hidden or posterior for the tongue tie. So again, more important than the appearance is the mother's and the baby's symptoms. So what are the main issues with tongue ties? Well, first off, healthcare providers are not taught about tongue ties in medical, dental, nursing, or graduate school. So there's lots of myths and misinformation passed down about tongue and lip ties, such as they don't exist, especially posterior tongue tie because it's harder to see. They don't cause problems with speech, feeding, or nursing. People think that the frenum will stretch or the child will just fall down and rip it, and some do fall down and rip it, but that's not the best treatment. A quick snip with scissors will fix the problem. Often you have to go much deeper or make follow-up cuts. And then a baby or child will need general anesthesia or sedation to treat, which all those, again, are just not true. Many babies have nursing difficulties that are not resolving. Kids with speech issues, especially R's, L's, S's, SH sounds, TH sounds, have a speech delay or mumbling. They can have lots of issues from a tongue tie. Airway issues because the palate and the nasal cavity is not expanded. Snoring and sleep disorder breathing in children and adults. Feeding issues like difficulty transitioning to solids, swallowing food, slow eating, real picky eating, especially with textures, and also reflux can be related to tongue ties. Dental issues in the future, so cavities, a gap, narrow palate or braces, V-shaped palate, and then also mouth breathing, which can lead to ear infections or enlarged tonsils and adenoids, is also common from a tongue tie. So for babies specifically, like we're talking about today, infant symptoms, there's several, but mainly a shallow latch, popping on and off the breast, poor or slow weight gain, short sleeping, and frequent feeding. There's constantly nursing. A lot of moms report it feels like a full-time job just to feed them. Clicking or smacking noises that when nursing or taking a bottle. Reflux or spitting up often. They're gassy or fussy a lot. Snoring, heavy breathing, congested, choking, gagging. Milk dribbles out of their mouth. They can't hold a pacifier or it just falls out right away. But for moms, it can also have painful nursing. Some moms say it's toe curling pain or 10 out of 10 pain. Others have very little pain. So it's not the best test, but it's just one of the symptoms that can go with it. Bleeding, blistered, cracked, creased nipples, incomplete breast drainage. They're not getting all the milk out. And that leads to poor or slow weight gain. And they also have infected nipples or mastitis, engorgement, thrush, and they can't nurse without a nipple shield. So how did I get into all this? It's related to my girls. Went through dental school. I had never heard of a tongue tie really. Went through pediatric residency. Hadn't even heard about it. But then once I had my girls, the lactation consultant told us they had a tongue tie. And I thought, no, they don't. I'm a dentist. I should know, right? But sure enough, they both had tongue ties. And we took them to the pediatrician. And they clipped it. And it didn't make much of a difference for us. And so in the meantime, we were syringe feeding. There's a picture from the hospital, but syringe feeding, using a finger feeder, trying to do everything we could to feed these babies, and it just wasn't working out. And so finally we took them to a dentist who identified them with posterior tongue ties after it had already been clipped. Here's Hannah right there with the laser safety glasses on at the dentist, and her tongue doesn't elevate all the way. You can see the small white line in the middle from the scar. And then there's Noelle on about day 2 of life, that she had a small string under there still, hadn't been clipped yet. But after it was clipped, made a big difference for us and helped a lot. And so then once we got down here to Alabama, I decided to help out with other people. And so here we are, 4 years later. So for the laser, it really has a lot of advantages. So there are many advantages to using the laser. There's minimal to no bleeding. It's less painful than scissors or a scalpel. There's better visualization during surgery. You can just see so much more. It's extremely precise. There's virtually no risk of infection. There's no need for general anesthesia or sedation. It's also very effective. We've seen over 95% effective. Excellent healing and less scarring compared to scissors. We also use the highest quality CO2 laser. It's called the light scalpel that vaporizes the tissue instead of burning it like a cautery or a diode laser. So all lasers are not made the same. I also achieved board certification in laser surgery as well as pediatric dentistry, and we perform more procedures than anyone in the state. So during the procedure, we follow all laser safety protocols, and we use protective eyewear for everyone in the room, including the child. We swaddle the infant in a warm swaddle to prevent movement that could make the procedure more difficult and ensure the baby's safety. The parents wait in the consult room during the procedure so we can focus 100% on the baby, and we will bring your baby back right away to nurse or feed. The procedure takes about 20 seconds for the lip and about 10 seconds for the tongue on average, and then another couple minutes to set up and position the baby and take photographs, so we're normally back in the nursing room in about 5 minutes. We want the baby to nurse or feed right away, and oral wound healing is rapid, so the scab will turn a white or yellow color after a day or two. It can look like an infection or pus, but it's not. The baby might drool more for a few days, up to a few weeks. You can give Tylenol at any age, even the young little babies, 6-pound babies. And then Motrin if they're over 6 months old, and it's all dosed on weight. You can do breast milk ice chips as well. So break off a little bit of frozen breast milk. You can give that to baby. Sometimes that feels good. Nursing bottles, nipple shield, pacifiers, that's all okay. Basically do what you can to keep baby comfortable and eating well, and then work with a lactation consultant or feeding specialist. Don't try to change too much right away, or else the baby can have a harder time. So don't switch to no nipple shield if you've been using the shield. It might be too many changes at once. Normally, your baby be sore for about 1 to 3 days, depending on the baby, but often by the 5th day, we see really good improvement. So for Tylenol and Motrin, here's the dosage, but we will tell you the exact amount for your child when you're here in the office, but those are just the general amounts. So post-frenectomy exercises. These are done to prevent reattachment and strengthen the tongue muscles. So we do these for 3 weeks, about 6 times a day. Try to switch up when doing the exercises, sometimes with feeding, sometimes with the diaper change, etc. We want to keep it as playful as possible with funny noises and faces, especially if the baby's older. Also want to play with the baby's mouth and tongue when you're not doing exercises to try to prevent an oral aversion. Keep the actual stretching of the wound to just maybe 5 or 10 seconds for the lip and 5 to 10 seconds for the tongue. So get in, get out, get it done. Don't make it too stressful on yourself. Use a camping headlight or have someone hold a flashlight to see the diamond at least once a day. If you can have someone do that, you can see what you're stretching. If you can't see it, it's hard to stretch it. First, lift the upper lip high to the nose so the diamond is fully opened. Then use a gentle massage right on the wound like a rolling pin to ensure it doesn't grow back together. For the tongue, come from behind. Use 1 or 2 fingers to lift the tongue as far up and back as possible. Put some tension on the wound, just ensure the diamond is opened up. You can also gently massage the wound backward using the same rolling massage motion to encourage the wound to elongate. And reattachment is simply the natural process of healing. So just like a cut on your hand will heal back together, the special cut under the lip or tongue will try to contract and heal together as well. We're basically trying to trick it to stay open. So this can happen easily if stretches aren't performed routinely and with enough pressure or tension. So make sure to stretch often, every 4 to 6 hours or so. Don't have to wake the baby up in the middle of the night, but I would do a good stretch in the morning if it's been a longer stretch at night. Use sufficient pressure, about the same pressure as like inking a stamp pad, and look at the site with a light. If it looks or feels tight, you can do a stronger or deeper stretch to open the scab again. There's a video on our website, or we can perform for you at the 1-week follow-up visit. If symptoms begin to return after they disappeared, so your symptoms improved and they started coming back after 5 or 7 days or even 14 days, then that's likely the reason it's growing back together. And finally, this is the team effort. So we can only do one part, but for successful nursing, feeding, even speech for older kids, there are other professionals that must be involved. So lactation consultant, IBCLC, is critical with a baby who has been having difficulty breastfeeding. So make sure you follow up ASAP or within 24 hours to continue to get as much help as you need until nursing is efficient and comfortable. A speech or feeding therapist, or SLP, can help with bottle feeding, solid feeding issues. We have a therapist in our office, Lauren, if you have any questions or like a consult with her, she'd be happy to help you out. A body worker, like a chiropractor, physical therapist, craniosacral therapist, can certainly help if your baby has any neck tightness, called torticollis, or other issues. and then for sure your pediatrician or primary care provider for routine visits, weight checks, any other medical issues at all. Like I said, it's often a team approach. Often the tongue tie is just the tip of the iceberg. And finally, for follow-up, I'll call later in the evening to check on you and your baby. You also have my cell phone number in case there are any concerns that come up. If you have any questions, please let me know, or you can call the office. Remember, it is a... And finally, I will call later in the evening to check on you and your baby. You also have my cell phone number in case there are any concerns. If you have any questions, please let me know, or you can call the office. Just remember, it is a process. It'll likely be better than the office, but could get more difficult for a few days, and then get progressively better over the course of a few weeks. So expect 1 better feed the first day, maybe 2 better feeds the second day, but still could be 6 difficult feeds. Just depends on the baby. Each one is unique. And there's also a Facebook group. So the Alabama Tongue and Lip Tie Support Group is an excellent group to look at other patients that have been here or other offices in the state, and they can really help you with any kind of questions that come up. Thanks so much for listening, and appreciate your time.